Hello, my dear friends. My name is Dr. Brodski. I am an anthroposophic physician and I'm also a GP. I work from Sussex, where I do my NHS work and also see my private patients both face-to-face and on Zoom, or video consultation, I mean to say, not Zoom. And I like to create these videos to help you be in control of your health and in some instances take control of your health back and not sort of give it away to the medical profession, because I do believe that is either the wrong approach or an incomplete approach, depending on the circumstances. Today I want to talk about infections, exemplifying upper respiratory tract infections such as the flu. And I'm going to compare two paradigms. One is mainstream paradigm and the other one is anthroposophic, because by embracing both you will have a complete picture and you will be more empowered in terms of what you do to prevent these infections and cure them faster. So you already know that from the mainstream or the usual medicine perspective, we focus on the viruses as a cause of upper respiratory tract infections. We focus on exposure. So for example, like during COVID, we were trying to wear masks to somewhat limit the spread, because upper respiratory tract infections are airborne. So basically we breathe them out when we have them, and we sneeze them out, we cough them out, and they flood the premises, we open windows, which is all good, it's all correct, but it's just one side. The other side is the anthroposophic perspective. So in anthroposophic medicine, we say, fine, of course, there are viruses, but it also depends on your susceptibility of an individual organism. And that susceptibility obviously is linked with multitude of factors such as the immune system, and you already know about that. So if, for example, you have to take immunosuppressive drugs, you just have to do it. This is also another topic, of course, to discuss. But what is it that we mean by the environment? What we mean by the environment is actually what's going on in the individual organism. So if I'm gonna give you some examples, right? Yeast, take yeast, thrush, and yeast skin infections, so on and so forth. A lot of the time people get thrush and yeast infections in their throat, in their vaginas, on their penises, in their groins, in their armpits, and so on and so forth, especially when they have diabetes. And why is that? Do you have an idea? The reason is because with diabetes, the whole problem is that there is more sugar in the blood than is good for us for a variety of reasons. And this is what I mean by the environment, because if your blood is full of sugar, the yeast on the surface of the skin, on the surface of the mucosa, such as in the mouth, in vagina, and so on, it's going to thrive and multiply, and it's going to cause you the thrush symptoms. So next step is to ask, what is it that we can do to reduce the chances of suffering from thrush, because some people perpetually are suffering from thrush on and off for years. So what we can do in this particular scenario is reduce the sugar in the blood, because then the environment will be altered in such a way that it will not be so convenient for thrush to grow and multiply. And of course it may also help to stop adding yeast into our system. Unfortunately, a lot of products we consume have a lot of yeast. So the most obvious ones would be breads, baked goods. Most of them are made with a bunch of yeast. Sugar, of course, as well. So this is like very perfect to propagate diabetes and thrush. And alcohol as well. So alcohol is made using yeast. Essentially, alcohol is a byproduct of yeast um, life cycle. It's something that they excrete. So what we need to do in this particular case to cure thrush or stop getting it is reduce the amount of sugar in our system and reduce the amount of yeast. It is actually quite a simple formula. I think it's also worth just adding in terms of reducing sugar, because it is a big topic, isn't it? With sugars, it all depends on how fast the sugar comes out of a particular food. So most people already realize that sugary drinks, cakes, and so on and so forth, they spark sugar pretty fast. But not everybody realizes that we also would benefit by looking at glycemic index of various food items. Glycemic index is a measure of how quickly sugar comes out of a food item. So for instance, lentils have low glycemic index, so medium, like 30 to 40 of memory, and they're not gonna spike the sugar too much, especially if you eat lentils with vegetables. But if you take potatoes, actually they are sugar bombs, especially if you bake them, but all potatoes have high glycemic index. So whenever you eat potatoes, it spikes your sugar. And of course, this is lovely for thrush. They're going, yum, let's multiply, live, and propagate. So it might be useful to check out the glycemic index for various foods and stick with lower indices. And of course, it's also to do with what we call glycemic load. It's just the sheer volume of food that you eat. Obviously, if you eat a big bunch of baked potatoes, the sugar is gonna go up, and it's gonna be difficult to bring it down. Why don't we now talk about upper respiratory tract infections, which is what I want to do. It is actually the same thing. It's all about the environment of the body from anthroposophic perspective. So what do I mean in this case by the environment? There are certain things that are polluting our organism, and we need to become attuned to this. We need to be able to feel into our bodies. So what pollutes our organism? Overeating, unfortunately, pollutes the organism. Alcohol pollutes the organism. Poor lifestyle pollutes the organism, like smoking does as well. Toxic thoughts, constant toxic thoughts. And I'm not saying that anybody's bad because they have toxic thoughts. We kind of live in a pressurized world, and it is a separate topic to how do we get out of our vicious negative cycles and, dwell on the positive as opposed to dwelling on the negative. But this is actually really important for health, because our thought forms are not just nothing. They create energy in the body, and they actually have like a cascading effect on our health, on the rest of the body, our energy. So about this toxicity, let's just have a think. When do we get like a really massive spike of coughs and colds? Well, being a doctor, I'm going to tell you it's usually after just after Christmas, obviously during the winter as well, but there's a particular spike just after Christmas. And what happens around Christmas? Like, the majority of people eat a lot, so overeating and drinking. Alcohol obviously is very pleasurable, but you have to consider that it's still a toxin. Neurons in the brain die by the hundreds, if not thousands. I have to look that one up. When we drink even a small amount, alcohol has been linked with all types of cancer. It has been linked with dementia. And I think, it's a very short-lasting pleasure to have such a price to pay. And another thing, both alcohol and overeating do in the long run, they give you fatty liver. This is super significant because the liver is the organ that detoxifies everything in our body, all the substances that we put into our body. And if the liver is fatty, it is not going to be functioning very well. And guess what? You will never find out about this directly. It's not that sort of organ that will give you pain. It's just, unfortunately, our livers, and I have a lot of compassion for livers, I love livers, they suffer in silence. I just think it is such a miraculous organ. It detoxifies everything. And we walk around, we just think, okay, I'm all right. And we toxify ourselves every day. A bit of this, a bit of alcohol, a bit of toxic thinking, a lot of takeaways, sugary foods, processed foods, water, then seafood products with worms and eggs of worms that, then live in our guts silently without any symptoms. But the liver has to detoxify all of this, because if we have worms, and I believe a lot of people have worms and they're quite hard to diagnose, the worms are kind of peeing and pooing into our organism. And how do we get rid of all that? The liver has to handle it. And a lot of the time you can see the person has kind of circles around their eyes because the liver is not coping, or they're not sleeping. There are like so many symptoms, but none of them are direct. So it's quite difficult to diagnose that liver is suffering. Of course, you get some blood test derangements, but this is a relatively late sign. Late, not in terms that it's incurable, it's very curable. Just change the lifestyle and it will reverse. Late in a way that, like I was saying, the liver can suffer in silence for decades without giving any direct symptoms. And we have to really, really take care of our livers, because anthroposophically speaking, our liver is the seat of will. And if our liver is damaged, our will gets weaker. I mean, it's quite hard to develop discipline and have strong will anyway without the liver damage. So, I mean, I would never take chances with my liver. I used to. Not like some people, of course, but I would never ever suggest taking, steps to damage your liver, even though most of the time the steps are taken totally unconsciously. It's just a little bit of pleasure here and there, but it all adds up. So now I'm going to go all the way back to what I'm talking about, is how, from anthroposophic perspective, it's the environment, i.e. our organism, that is making it easy for the bacteria, the viruses, the yeast to grow. And this is where we do have control, by altering this environment within our body to such an extent and in such a way that we make it harder for the bacteria, viruses, and yeast to grow. So what do we need to do? We need to clean our body. Yeah, it's not a joke. We need to clean our body. So I would say alcohol is off the cards, really. It's quite a toxin, and some of you, I don't think a lot of people who like to drink alcohol on a very consistent basis are going to be watching my videos anyway, but for the rest of you who are keen to prevent long-term ill health, I would suggest stay away from alcohol as much as possible. What I do at the minute, I probably haven't drunk for like anything significant. I think I've had like a drink which was supposed to be non-alcoholic, but it had a little bit of alcohol, and it was a tiny amount. If I don't count that, then it would be like I haven't drunk for a year. I know I will drink, but it will be such minute amounts and it will be super infrequent. So this is one big thing. Another thing is fluids, water. We need to flush everything out, all the toxins out with urine. So we do need a lot of water. And for those of you who hate drinking water, it is a problem, because actually when you drink tea and coffee, they are diuretics. They do not help your kidneys because they dehydrate in the end. Herbal teas are fine though. Herbal teas are okay. squashes, maybe, but with lots of additives and other chemicals that perhaps are not so welcome. So we said cut down on alcohol as much as possible, cut down, cut out. We said hydrate, drink water, or herbal teas are fine. Now, the other problem that most people do not realize, but it's easy to realize this and it's easy to experiment and get your own evidence, is that animal products actually produce a lot of decay and toxicity in our body, all animal products. And in the 21st century, my feeling, very strong feeling, is that we all eat way, way, way too much animal-based foods. I mean, all of the animal-based foods. I think as a society, we really need to cut down on the amount of animal-based foods that we produce. They are actually quite toxic if eaten in the amounts that average, say, British person or American person consumes. We don't need that much protein. In fact, protein in those quantities is actually toxic for the kidneys. It's not a good thing. And anthroposophically speaking, all animal products, they are hardening for the body. So they have a role to play in atherosclerosis, which is basically both from mainstream medicine perspective and from anthroposophic perspective, they coat the lining of the blood vessels with fat, but also hardening the blood vessels. This is more of an anthroposophic perspective. And what is hardening your blood vessels? From mainstream medicine, we know that calcium is deposited in the blood vessels. That's why a lot of people with time develop high blood pressure later on in life, which is no longer related to their lifestyle. It's just because the blood vessels have become so calcified that when the heart contracts, it pushes the blood out. The blood vessels no longer expand to accommodate this, and blood pressure, especially the systolic blood pressure, well, and diastolic as well, actually, both are high. So let's go back. We're talking about toxins. Animal products, when eaten in excess, are toxic. Now you are definitely going to be thinking, well, so where is the cutoff? What's good and what's toxic? And I'm going to say that this is highly individual. I'm going to say we're going to have to learn to listen to our body and see how we feel and what is and isn't good for us. And of course, I personally find that as time goes on, as the person gets older, it's much easier because the body becomes much more of a fine instrument and it gives feedback faster. Whereas when we're much younger, we have such a strong etheric body that it just accommodates and copes with a lot of damage without showing the signs. But I don't want you to be damaging your bodies, because there is a price to pay later on. There is no point. Okay, let's just summarize. We've talked about hydration so that we can excrete toxins. We've talked about reducing sugar intake. We've talked about cutting out or cutting down as much as possible on any alcohol. We've talked about animal foods, which can be toxic, very, very toxic for the whole organism, and also anthroposophically speaking, linked with atherosclerosis, which is hardening your blood vessels, the deposition of the fats inside the blood vessels, and hence linked with heart attacks and strokes, and of course in the first place with erectile dysfunction, because that goes before heart attacks and strokes, because of the fineness of the blood vessels in the area. They get blocked up faster. The other thing, of course, you're gonna know this one is smoking. It is another toxin. And by the way, if you're thinking that this is really difficult to give up those habits, right? Yeah, it can be. It can be. I fully respect that struggle. And this is why you need professionals to help you. So, for example, in anthroposophic medicine, we do have a few things we can use to help you overcome addictions. But also I'm going to be, when you come to me, if you come to me to see you as a, in my capacity as an anthroposophic doctor, I will also be pointing out emotional freedom technique, because that technique actually even more so emotion code, both of them, but emotion code, this is the one I wanted to say, that was a slip of my tongue. Emotion code technique, which helps us remove stuck emotions, because behind addiction there is obviously trauma and so on, but to simplify it somewhat, there are stuck emotions, and by removing those emotions we can actually help remove the causes of addiction. I know it can be done gradually over a period of time. So the other thing that toxifies us is actually these toxic emotions. They are very tough on our body, they're tough on our soul, they're tough on our energy, and they're tough on our body. We all have unresolved, stuck emotions we need to be handling. My wish is that emotion code becomes part of mainstream medicine. I don't think it's going to happen in my lifetime, but I find that emotion code is an amazing accompaniment treatment for every single health condition. Yeah, from mental health down to physical, all physical conditions and cancer. Because I feel our liver, coming back to the liver, is actually taking part in detoxifying the body, but our body also has to handle the results of our toxic feelings and thoughts, feelings of hatred, feelings of anger, and they're not so easy to pick up sometimes, because sometimes you think, well, of course I don't hate anybody. But then if you are more honest, you will look at all the irritations that we feel towards other people. Well, this is on a spectrum of hatred. So this is how we create a clean environment in our body, so that we are less prone to infections of all kinds. Upper respiratory tract infections, i.e. viral illnesses, bacterial illnesses, yeast, so on and so forth. So this is how you can take control back, take your power back. You create clean body, avoid alcohol, avoid excessive sugar, avoid processed foods, additives, and clean up the feelings and the thinking. This is a separate big job, and it's worth engaging in this, because it makes such a big difference in our lives. Because we can't really feel well in our body if we don't feel well in our soul. If we're suffering, depressed, angry, the body also suffers, and you know that. So I hope this was helpful. If you have any questions, I think I have opened up comments, so you can leave me a comment. Sending you all a lot of love. Bye.